I think you went that way.
November Human Service Advisory Board meeting to order, and I'll ask Blair to do roll call. Mr. Bettle,
Here.
Mr. Steen,
Here.
Ms. Fry,
Here.
Ms. Haugen,
Here.
Mr. Davison,
Here.
Mr. Mandler,
Here.
Ms. Czar, Ms. Bollinger. Here. Thank you. The minutes are next on our agenda, the October 6th minutes, and I think there is a slight adjustment to those. Because we had every board member here present. No one virtual, or I can't remember. Yeah. So Julie and Jen were here, and Dan was in person as well. So I guess we will make those adjustments. If I could have a motion to approve the minutes with those adjustments.
So moved. Second.
All in favor, say aye.
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 Any opposed, same sign. Thank you. One item that we brought up in October was the Human Service Advisory Board terms. And at this time, both Kyle and Rick and Joel, usually the commissioners look at that in December, but Kyle and Rick both have upped for another term on the advisory board. So thank you for your willingness and to serve the next term, and whatever the commission decides, Joel, you're more than welcome to continue as well. Just keep me posted.
Thank you.
But that's how we'll be moving forward. We can, as a board, add members at any time. We don't do it on the same role as the commission assigns to different boards. So maybe in 2026, if we want to think about if there's a segment that's missing or that we would like to add, keep that in mind. We have a special guest with us today, which I think it's a timely topic. So it just worked out well, and I thought I welcomed Rebecca, but I want to give a little background for Rebecca. When I started here at the Zone, Rebecca was a team member in our economic assistance. She was one of the supervisors there. She flew to the other side. Just kidding. But she is the director of economic assistance quality control. So she has come out to our zone a couple times and met with our department. We have SNAP is a hot topic right now for many different reasons in the state of North Dakota and nationally. And then they have done heat visits also. I talked about that at another board meeting. So the information Rebecca has shared, I thought it might be best sometime to come here and share with you as zone advisory board members. And we went through her packet on Friday. It's a lot of information, but feel free to stop, ask questions. I'll let Rebecca do a little introduction of herself and start.
So, good afternoon, I almost said good morning, good afternoon. My name is Rebecca Askins, and as Gail had mentioned, I'm the Director of Quality Control. I have a little over 20 years experience in economic assistance. I've been in North Dakota now 4 years. Originally came from California. So, same efforts in California. So when Gail provided this opportunity, I kind of jumped at it because I know there's been a lot of questions on SNAP. I know there's also questions on the HR1 or OBBBA or One Big Beautiful Bill. So I thought we would kind of go through some of this. The packet may be a little bit misleading only because I will talk quick, I promise. And I will not read it to you verbatim. I just wanted to have the information available so you guys can look at it, you know, at your kind of leisure whenever you get the opportunity. Kristen Hasbargen is also here, so thank you, Kristen, for making the trek. That's okay. So really quick, I know we wanted to talk through some SNAP program compliance issues, and then again, we'll also talk a little bit about HR1 and some of the ramifications that HR1 is going to mean, the impacts on SNAP primarily. So if you turn to your program history, again, just kind of for an overview, food stamps was actually started, it was called food stamps at the time during the Great Depression era, but in 2008 was when it became an official federally funded or federally ran program, changed the name from food stamps to SNAP. So a lot of the rules that we kind of utilize today will trace back to, we've got Perora and all of these other acts that kind of trek through the years, just sort of guiding with updates, but the official name change from food stamps to SNAP was in 2008. The next slide will kind of talk to you a little bit about some highlights over the last 20 years. Again, really quickly, 2002 was when the introduction became, at the time in 2002, they actually had a penalty and a bonus system. The penalties imposed had to do with what we're currently working through now, right? They're directly related to the payment error rate. We've got some related to the application timeliness. You can see that in 2013, the rate started to decrease. But also what happened in 2013, OIG, the USDA OIG, conducted an investigation and found that the bonuses that were being offered to lower the rate actually introduced bias into the system. It was manipulating the QC data. So now those bonuses have disappeared, but the penalties have not. So the Farm Bill in 2018 actually removed the bonus component. So DOJ is still kind of working through the False Claims Act of 42 on those states that were found to have manipulated the QC data. So far, I believe that's a total of 42 states. The next slide is just a quick talk through of the budget. So SNAP overall, as you can kind of see there, makes up approximately 59% of the total EA budget. On average, we serve close to 28,000 households. That's roughly 43% include a child under the age of 18, and also an aged individual. SNAP defines age as 60, so 60 plus is roughly around 23%. Our average benefit for the household is roughly $360 a month, and we offer a little over 10 million a month total in SNAP issuance. So just to kind of break down in a pie graph on kind of what we're looking at as EA funding and where the majority of that funding is going. SNAP, of course, is the largest program that EA offers at this time.
Rebecca, is there a maximum benefit for a family?
Yes.
And is there a minimum benefit?
So maximum, yes. The maximum right now for, let's just say, a household of one, we'll keep it easy. And of course, maximum is there would be no income to offset that. So the most that one person could receive is $292. The minimum for that, it depends on the type of household. There is a categorically eligible household. It has some tricky budgeting, but if you're looking at a household of one or two, they will receive a minimum of $23. It's very particular budgeting for a certain type of household called broad-based categorical eligibility.
Thank you.
You're welcome. The next slide is new data that was actually released from the National Grocers Association. It just kind of talks about the overall SNAP economic impact. So, and again, I'll kind of focus on the first two. So it did create 421 new grocery industry jobs and about 28 million in grocery industry wages that was generated from SNAP. So next is actually the list of retailers broken down by zone, or I'm sorry, by county. So as you can see, Cass has 113. Overall in North Dakota, there's 570 retailers that are authorized to accept SNAP. There's 14 farmers markets, and there's 14 retail stores that offer SNAP online, which is exactly how it sounds, right? You place the order online, it's delivered to you. They can utilize their EBT card to pay for that. There's currently 14 retailers in North Dakota that offer that. So next we'll kind of talk a little bit about the regulatory statutes. So this statutory law that we're talking through here, Public Law 88525, is the law that governs program timeliness. So because of what this law contained, our regulator, which is USDA, came up with the mandatory requirement that applications have to meet a 95% timeliness rate. So the first section, the 2020 E3, is talking about your regular SNAP applications. Those are your applications that do not meet the emergent qualification. Those have 30 days, no later than 30 days, those have to be processed. The secondary provision deals with those individuals that have met the expedite criteria, and those have to be processed within 7 days.
Is that 7 calendar days?
Yes.
30 calendar days.
Correct.
Okay.
Yes, they do not count business days. So for quality control, I'm gonna kind of summarize this. This is a 2-tiered process. So SNAP, along with Medicaid and child care, they're subject to the Payment Integrity Information Act, or PIA, of 2019. So those contain a federal component to those where we are actively making measurements of payment errors and taking steps to produce fraud, waste, and abuse, which is basically an improper payment. So with SNAP utilizes a 2-tier process where the reviews start with the state, which is my team. So my team will have a random selection of cases that they're going to go through and review. The next process in that is the state, the FNS, our federal partners, or our federal quality reviewers will get involved at that point and do a federal re-review. So it starts with the state, and then the feds get involved later on in this 2-tiered process. Again, what they're looking to ensure is that we have program accuracy, that we have program consistency, and that we have mitigated payment errors whenever possible. And then from that data, we provide those rates that you are common to seeing. The payment error, the timeliness, we'll talk about CAPER. Those are produced by the state, and then the feds coming alongside and vetting them. This just kind of talks about the overall QC process. So my team utilizes what is called the FNS 310 handbook. The FNS 310 handbook is what my team is mandated to follow. It's over 400 pages. It's the guidance on all things QC given to us by FNS, our federal partners. It also guides in there the interactions that my team is allowed to have with the eligibility side of the house. There's only 2 criteria with which it is permissible for a QC reviewer to reach out to an eligibility worker, because they're trying to protect the bias in the program integrity. So for sampling, FNS provides basically 2 choices for states that are going to do their sampling plan. They can do the standard. There's a standard option, or there's a minimal sample. 80% of the states currently are on the standard plan. We have elected for the minimum sample. That is due to the size of my QC team. The standard sample is 1,020 cases. Every review that we transmit to our federal partners, so we utilize a federal system. It's called SNAP QCS, where we upload everything, we send this over to our federal partners. In addition to the documentation that's housed in SNAP QCS, I would say probably on average there's about 60 to 100 additional documents attached to that and sent over to our feds for review. And after that process has been completed, we will go through a corrective action process. If there's a payment error identified at $1 or greater, Then my team will do what is called the SFN 512, which is the notification to the zones that say, hey, this case went through a QC review, we identified this error, and it'll offer the corrective actions that need to be taken to make the case whole.
So question, you mentioned that the size of your staff, within the SNAP, within the block grant that you receive, do you pay for your staff out of the block grant, or do we fund it with state general fund dollars for your staff?
So we would be through the administrative fund, so that's
The
SNAP portion.
administrative fund through SNAP?
Yes.
So when you say the size of your team, while you pick it, don't states all have the same percentage of dollars that they can receive because it's a 10% of that administrative block grant to the SNAP?
Yes, and we can just kind of choose to go through how we wanna set up the teams. I would say on average, a healthy caseload for QC, and there's been some research on this nationally. A healthy caseload for QC would roughly be probably 8 to 9 active cases and then maybe 10 to 11 negative cases. What I'll tell you in North Dakota is our population continues to increase, and so therefore also does the SNAP caseload. So we have continued to address our QC team on expanding that out to take more and more cases. It's just as the year continues, we will adjust as we need to add a member to the team to meet that minimum required sample. There are other states
So
that still do.
I might have misunderstood you, so when you said administrative funds, were you talking federal funds?
Yes.
Okay, I was just making sure it
Yes.
wasn't the 457 fund, I didn't know.
No.
Administrative.
No.
Okay, very good, thank you.
You're welcome. The next slide that we will talk about is actual payment, or we're gonna talk through the application, the HEBR, and the, payment error rate. So at the very top, it'll tell you what those federal targets are, and again, those are set by our federal partners. For our payment error rate, it has to be 6% or less. For our KEPR, your KEPR is short for case and procedural error rate. Those are those negative cases that my team looks at. That has to be below the national average. For our timeliness, that has to be 95% or better. So what I've done is I've broken them out. I've showed FFY 22 through 25. The caveat to 2025 is the QC reviews have been released, meaning that FNS has taken over the process through May of 2025. So when you see 2025 data, that's basically a mid-year snapshot. 2025, this federal fiscal year is not completed. Quality control reviews cases following the federal fiscal year, so we start 10/1 and 9/30. So what you have there is you have North Dakota, you have CAS, and then you have the national average. When we're talking about generating that percentage for CAS, so let's just choose 2025's mid-year active case, so that 8.60. That is calculated based off of where the worker is housed that took the action. Meaning that that is the percentage, that's the payment error rate driven by Cass County staff, if that makes sense. And then of course that state rate is overall, and then you have the national average. As you can see there in 2025, currently our payment error rate is 7.2.
Can you, when we talked about this is we're always reviewed, Cass Human Service Zone, because of our size.
Yes.
So
Yeah,
our
and some of the,
workers-
and some of the initiatives that we'll kind of talk through too, talk about what's the best way for QC to really, be efficient with our resources, right? And overall in North Dakota, yes, there's gonna be 4 to 5 major zones that are going to consistently have cases sampled from quality control and generating rates, yes.
And those are workers, not necessarily residents receiving the benefit. It's the work we might be doing.
Correct.
somebody in.
Yes, when QC's doing the random sampling and generating those results that are driven off of people, yes, there's gonna be about 5 top zones in North Dakota that are always going to be in that process. The next talks about the SNAP APT, which is your application processing timeliness, the escalation process. So currently, FNS has a 5-step escalation process. North Dakota is currently in the advanced warning process, or step 3. So you can see there the date that USDA placed North Dakota on the escalation cap, which is a corrective action plan. FNS has notified North Dakota that we have to have at least 5% improvement in our overall APT rate every 6 months. That is part of the escalation. The next two are a formal warning letter, and then you also have a sanctioned administrative funding. So again, just to reiterate, there's a 5-step escalation process. North Dakota is currently in step 3, and our measurement right now is that overall 5% improvement over 6 months. So I'm gonna talk a little bit about the Big Beautiful Bill. I'll kind of go through a real quick drill down on some of the guidance. I can tell you that states were advised that we would receive final guidance on HR 1 on September 30th. And then you know what happened on 10/1, right, with the shutdown. So we still do not have the full entire guidance on how to roll out HR 1 with the shutdown now in progress. I can tell you though that FNS did notify the QC teams across the states that they will start reviewing cases according to the One Big Beautiful Bill. So some of the provisions that we'll talk through next, even though eligibility may not necessarily be seeing them, your QC team is going to have to review to HR 1 just because of federal guidance. So quickly, it just talks about the One Big Beautiful Bill, also called HR 1, that was signed. It was passed in Congress on July 3rd, signed into law on the 4th. There's significant changes to Medicaid, SNAP, Medicaid primarily in the Affordable Care Act. And there's also new conditions of eligibility and federal cuts, federal range of cuts that were introduced with HR 1 or OBBBA. The next is the timeline. So effective 7/4, so immediately upon enactment, the following provisions became law that had to do with your ABOD, your non-citizens, the standard utility allowance, and restrictions on internet expense. After this, you can kind of work your way sort of through the timeline. Eventually, there are other things that are going to continue to roll out, of course, starting with the federal fiscal years.
Can you say what ABOD is?
Able-bodied adult without dependent. Your very next slide is all things ABOD. So ABOD has to do with exactly that. It's an acronym for able-bodied adult without dependent. They could potentially face additional work requirements depending on their household status. The other significant thing with ABOD is they are only eligible to 3 of 36 months unless they have employment or they volunteer or train for at least 80 hours a month. So that slide is kind of talking to you about some significant changes. The biggest, of course, is the overall impact to the years. Now we're looking at ABOD at 64. It used to be 54. The dependent of a child used to be 18 and now it is 14. It also ended some exemptions and introduced one new one regarding Native Americans. There were 2 changes to the Thrifty Food Plan. When this sort of happens is staggered. The first that's going into effect is capping the household at 9+ members. So when you're talking about eligibility, you're looking at a myriad of things, and one of those things is number of eligible household members. Now that household member is capped at 9. The Thrifty Food Plan will not look at another individual after that 9th member. The other thing that it's going to do is in 2027, the Congressional Budget Office, the average monthly benefit potentially could be reduced by 2030. Overall, it used to be that Thrifty Food Plan would be evaluated and updated annually, but HR 1 changed the rules on this. USDA can make a recommendation, but it must be cost neutral, and there has to be a decision made on whether or not they're going to accept USDA's recommendation. The first proposal that USDA has planned to release will be in 2027. So in essence, that Thrifty Food Plan, that minimum right now is just going to hold until USDA does a recommendation. The next change is related to non-citizens. So in essence, there are certain individuals that were eligible to receive SNAP. They're considered qualified non-citizens. Undocumented undocumented immigrants were never eligible to receive SNAP. HR 1 made additional changes to the non-citizens. So in essence, the asylees, refugees, and the humanitarians are no longer eligible to receive SNAP. They must now be a citizen, whether that's US born or naturalized. They have to be a lawful permanent resident or a Cuban Haitian, or a member of the, it's Compact of Free Association, but as you can see, they're set islands that they are from. Now, those are going to be the only individuals that are going to be eligible to receive SNAP. Then you have changes to SNAP Ed. SNAP Ed was working in conjunction with SNAP. Federal funding ended for SNAP Ed in 2025, so that actually sunset at 9/30. North Dakota was able to stand that up from rollover funds. And so in 2026, we have continued to operate SNAP Ed as permitted with rollover funds that we did not utilize from 2025. So the next one deals with some federal changes to funding, primarily funding match requirement based on payment errors. I think this is probably the biggest one that is being discussed, at least among states, is the link between that payment error rate and the potential costs to states associated with it. So states will have to start paying a percentage of the SNAP benefit allotment basically on a sliding scale. 100% of what goes onto the card, or 100% of those benefits when they are issued, those are federal funds. That is a federally funded program. With HR 1 though, states that have that payment error rate of 6% or higher will have to start paying a portion of those benefits that are going onto the card. Your next slide is going to show you that sliding scale. So we currently, again, that projection is roughly 120 million. The state error rate, so states that have an error rate between 0 and 5.99, remember that 6% is that rate that FNS has set. So anything less than their set 6%, and states will not have to cover any. Any payment error rate between 6 and 799, they would be required to pay 5% of that. That's the overall cost impact on the biennium, is the bar that's for showing the cost impact. 8 to 999, and we would be required to pay 10%, and 10% or more, we would be required to pay 15%. Just as a reminder, currently North Dakota's payment area is 10.20. That is why it's highlighted green there, because currently North Dakota falls in the 10% or more, or we would be covering that 37.5. So kind of the next question is, what leads to payment errors, right? Like what causes this in the SNAP program? So an improper error will occur when either the household received benefits they weren't eligible to, or the household received wrong benefits overall. So either we granted somebody that was never eligible to begin with, or we inadvertently maybe issued more or less than what they were entitled to. Those errors can be caused by either client or zone, right, or agency as it's called by our federal partners. When they may occur, so they can occur with the zones if we've inadvertently had like a processing error, perhaps we've maybe transposed a number, that's common. Another is if we've missed a household update in calculations. An example of this might be someone has had a newborn and was not added to the case, or when policy is incorrectly applied. This can be a number of things. This can be, for an example, going back to those ABOTs, maybe that individual did have an allowable exemption and unfortunately we didn't issue this. And so we've clicked their ABOT clock, right, and utilized a month when we should not have done this. Those are kind of some examples of errors from zones, errors from households, when they fail to report inaccurate household composition or they fail to report accurate income information. Quality control does not measure fraud. We are not looking at fraudulent activity, so we are not looking at trafficking of any benefits, the sale of benefits. That's not a QC function. We're looking at those across the board measurements: payment error, timeliness, and CAPER. So some suggestions to improve. These are some things that we're currently working through. The HHS initiatives to try and reduce SNAP. So, and again, Gail kind of alluded to the heat visits, but focusing on those oversight and local support. 60%, and we kind of talked about this a little earlier too, but 60% of the errors are primarily from 6 zones in North Dakota. So again, if we can, and those are both good and bad rates, right? Just overall, those 6 zones typically do 60% of the rates. So really focusing in on those, we did launch the heat visits, which is the high efficiency and targeted training where we're on site, just kind of combing through what's working. And so continuing to do that, continuing to work on policy clarity and training. So really focusing on the trainings of the training needs of the staff, what's needed, what are some trainings that supervisors are asking for and how to stand those up. Data-driven quality control and technology. So again, just utilizing those error proofing cases and trying to really drill down on where are those errors happening, tracking that and being able to generate that data into usable information on training practices. And then we have consulted with some vendors, a few of them are kind of listed there, on ways that we can be proactive on tackling the payment error rate and mitigating those errors before they occur, right, as a means to try and reduce the overall payment error rate. So the state response measures, this is just to kind of say that overall, right, we're taking a little bit out of each of those buckets. So we're taking a little bit out of the collaboration with those zone heats, we're taking a little bit out of policies and making sure that our policy manual is current. The policy manual recently went through a 100% complete rewrite, the SNAP policy manual that was released. And so some of that information was completely updated, completely renovated and rewritten, so that has been released. Enhancing technology. Spaces is kind of always an ongoing topic, right, on the needs of spaces and making that updated to continue to meet the ask. And building staff knowledge, which again just goes right back to those SNAP trainings, targeted trainings, right, using that data to really help us focus on what trainings are needed. Overall, that will help us to kind of then really work through the customer experience to make sure that they understand those reporting responsibilities. When do you need to call us? What do you need to tell us when you call us? So we're also providing that education to them as well to try and mitigate those client-caused errors that can happen. Any questions?
I just have a real basic question. SNAP eligibility, is that purely income related or is it asset related as well?
There can be an asset test depending on the household. So overall, your SNAP cases in North Dakota will not have an asset test because of that categorical eligibility, back to that $23 minimum payment. Some households though will have an asset test. Usually those are your elderly and disabled households that might have to have an asset test. There could be some situations where they're sanctioned, so it just depends on the caseload. I say it would be a safe estimate to say 70% are not going to have an asset test.
And that's determined by,
It's determined by, so North Dakota offers what is called broad-based categorical eligibility. So in essence, at the beginning, when the clients come in and complete an application, they're given a flyer. And so literally because they're given this information, we are allowed to test them at a higher income percentage and not test them again with assets. So we in essence waive the asset test and it allows us to change that income limit from your standard SNAP practice. We're allowed to increase that up to a different federal poverty level to try them against. So because that happens, that is predominantly the kind of caseload that North Dakota would see, which is why most of our cases are not going to have an asset test involved in that.
thank you.
You're welcome.
Questions? It's a lot of information. I've heard it now probably 3 times and I still like, oh. Can you share a little bit, Rebecca, like what our workers are doing? You know, the error proofing, the narrative, like what a day-to-day worker doing SNAP, what are we doing to bring that error rate down?
Sure, so some of the things that we've launched, yes, we do have a narrative template. I think two of the things I think that we've recently launched, and of course, right, it's changed and so we're still kind of working through navigating that. One of those is a checklist that we've created for the interview. Naturally, when you meet that family for the first time for SNAP, they're required to have an interactive interview. So there's a lot of information that you're gathering there, right, but you're also trying to impart a lot of information to them too. So that checklist was a combination of sort of working with our federal partners on that, but that's really helped. Another initiative that we've just launched are quality checks in that system, so then leveraging that system piece. So from QC-driven data, right, we know where the common errors are, and so now we kind of provide prompts. So when the workers are wrapping up their case, they'll get a prompt from the screen that will say, this client has no income, is that correct? So kind of trying to mitigate that, stopping the worker, if you will, to just kind of confirm like, yes, I meant to do this, this is correct. I think the heat visits have also helped. One of the things that the heat visit did was it actually talked about the zone's specific info. You know, it's a little different when you're kind of talking about what your day-to-day and your impact with your peers is versus just the overall state rate all the time. So that's been a lot of really positive feedback that we've had on that, just kind of talking through. QC's done this not this particular, but a lot of presentations recently to just provide that educational piece to the worker. So again, we're kind of trying to do all of these efforts. We've launched some additional trainings. Of course, with HR1, we'll have more trainings coming up. And I think a lot of good feedback from that is giving the supervisors the option to go into our training team and say, hey, we really would like to see a training stood up for this, and having that training team kind of build that and launch that. So lots of things that we're kind of trying to continue to sort of work through the overall payment error rate. And we'll continue to kind of use this QC information to find other things that we can continue to do to try and work through that.
Rebecca, on one of the slides you talked about, it says new conditions of eligibility and federal funding cuts. So outside of the SNAP Ed, what funding cuts are there?
So there's gonna be a change to the cost of administrative, the administrative cost sharing is one.
So
This-
administrative cost sharing is the amount of money you can use to run the program?
Yes, currently it's a 50-50 split, that will change to 75-25. The other change is again that cost associated to the states having to potentially pay back money for the benefits because of the payment error rate.
Well, that's not a
Tradition-
cut.
Not a cut, you're right, it would be an overall cost to the state that we have yet to
So when does the cost share for the administrative services go into effect?
2026, and that's on the chart, the kind of
Oh, there it
timeline,
is.
if you will,
Yep.
yeah.
Yep. So that those are the cuts, the administrative and the SNAP Ed.
Correct, as far as cuts, yes.
And SNAP-Ed, has continued, but that will be just with,
Yes.
rollover dollars.
Correct. Yeah.
And that's done by different entities. Here it's Extension in Cass County. Okay. Questions? It's a lot of information. You have a packet. Rebecca's contact information is there, and you know how to get a hold of me. I think the other thing to definitely talk about a little bit, and I don't, more, but you can chime in, with a pause in SNAP benefits currently. Pull out, just wanted to give you a little update of what, we've done here in Cass. Mainly starting really last week. There was a press conference. We've also, zone directors had the opportunity to meet with interim commissioner, deputy commissioner, and then prior to that press conference, just to understand what was going to be happening to support in that avenue. But then internally here, or within Cass County, there's been a group, Jen Ball with Fargo Cass Public Health and myself, actually, she was at the Association of Counties conference, so we got together there, and we're collaborating with like United Way, Emergency Food Bank, Great Plains Food Bank. We contacted the 7 school districts in Cass County. We kind of divided and conquered to come up with some internal messaging and external messaging. Because our community, we know, wants to help. I know I got a contact from the Northern Cass School District, and she emailed back this morning and said, my office is overflowing with food right now. So we're trying, United Way is gonna help get that message out there, like where you can go help and volunteer, and one unified message for all of Cass. Internally in the metro area, there's a lot of resources. Emergency Food Bank will be getting some information out too, probably starting today, regarding how they're going to serve. But there's gonna be a need for volunteers, there's gonna be a need for dollars. And I have not heard, and maybe somebody else has heard, has there been an increase in calls to the, call center, support center?
I can answer
Yeah.
that if you'd like.
Yeah, go ahead.
The update was, it's a Monday, which is busy. It's the
Mhm.
first Monday of the month, which is usually busier. But they are not more than what they've been. The majority of the calls are not about SNAP,
Good.
stuff. So far so good in
I-
terms of, wait time is increasing a little bit this afternoon, compared to morning, but seems to be under control.
I have a feeling it will be more like towards the end of the week or next week, and it continues. Those sorts of things, but we have a good community group, trying to get some messaging, so you'll probably see some of that. I forgot to bring the posters. The state, ND response, North Dakota response, is that the, I think is the like, one-stop shop online for anything, and they have provided some things, so I worked with Catlin to get some of that out. But really working towards a community response, and not just each entity. Doing Great Plains is well on its way, and ideas for pop-ups. I'm more probably, how do we get to the right rural areas in Cass County? And then if there's a need to deliver, so we need to reach out to some senior centers as well, things like that, or, VA care, things like that, that are working with them. So that is a little bit about, the local response here. And there just happened to be a hunger summit. The Cass Clay Hunger Coalition was meeting on Thursday, Wednesday of last week. So that just kind of, there's a little bit of that, but there was a lot of going on Wednesday, so only got to about half that meeting. I added an operations report in there, and you can read through that. It talks about, there is a new, APS at HHS director. Allie Brown is the new program administrator for our APS team here. That's kind of a grant basis that we provide that service. And then Shana included the economic assistance, as well as the numbers that we normally provide related to child protection. And those numbers, our case count for CPS continues to, I just pulled off our open case count this morning. We did it every Monday morning, so what's in your report is a little lagging, because when we pull that data, but it's about 315 open cases at this time. And the last 2 weeks have been very busy on cases, but the positive thing, we have a more strengthened team. So there was child welfare training, certification training, though, that brings some numbers down as far as availability. But and we just are onboarded, welcomed a new CPS worker this morning. Had orientation with her, and I want to call up Kendra. She is sitting in back. She is a intern with us in Family Services. So welcome, Kendra. The rest of the crew behind you are the supervisors, and Shana, of course, you see in economic assistance. So they're the experts, and they deal with a lot of questions right now, both from workers, and so we really appreciate that. Yeah. And then the basic operations report and their staffing and turnover data on the back of that. Any questions? No questions? Wow. Well, I guess if there's no further questions, I would call for a motion to adjourn.
Move to adjourn.
Second.
All in favor, say aye.
Aye.
Opposed, same sign. We will see you in December. December 1st.
Thank you.